My name's Steve, and I'm from Orange Hospital, so part of Bloomfield. And I come from a large group of very passionate pharmacists, and we work on servicing about 180 beds in the mental health space. And we've got beds right from forensic beds right through to drug and alcohol, through acute, and trying to stabilise them and get them out. And the key really is patient focus and outcomes as a group. That's our vision.
So you've been involved in a project that highlighted some big gaps in practice. What was the project about?
In particular interest was to facilitate improved care of mental health clients, especially in the community mental health space. So we found the growing concern of metabolic conditions, which is very prevalent, and wherever you bring up mental health clients, that's the topic of conversation now. And our concern was what's being done in the metabolic monitoring space and what's being done in the medication review space.
Can you just explain metabolic monitoring?
Yeah, absolutely. So with the current use of antipsychotics, and we know that they're the mainstay treatment for schizophrenia or schizophrenia-form illnesses, and antipsychotics, however, work great to diminish psychotic symptoms, but they carry significant side effects, and one of them is metabolic disorders or metabolic syndrome, which is characterised by increased girth, weight, etc., obesity, and ultimately increased risk of cardiovascular disease, together with diabetes, which is a growing need and concern and high cost management currently in Australia. So we're treating all these patients for their illnesses by reducing the psychotic symptoms, but we're also killing them slowly through the emergence of these cardiovascular risk factors and diseases.
So that became quite an issue for you in this project. Sorry, I interrupted you on that. So how did it manifest for you in your area?
Yeah, so in our area, we did some baseline studies, and we found that less than about 5% of clients that attend community mental health visits actually have a documented metabolic review, which just goes to say current guidelines state every 3 months, this is in New South Wales, a patient should have a point of care glucose, cholesterol testing, so we know that if there are variations in these, that prompt attention can be given and managed in this setting. But however, the monitoring itself is not happening, the screening, the first step isn't happening, and hence we went out to implement a project that integrated the several roles of multidisciplinary teams. So I'm a pharmacist. Together with the lead of a pharmacist, we had a dietitian, we had a psychiatrist, we had the GP involved, and other NGOs in the area to sort of come up with a shared link model, which was only possible through integration.
And can you tell us how that worked and what that's been like over the longer term?
So the project was run over 6 months, thanks to the sponsors of Western New South Wales who funded the project. And we found out that the pharmacist, who was a specialist mental health pharmacist, was ideally placed to integrate these several roles. Often there's a lack of connection between a public hospital system and a community mental health, or a GP for that matter. So the pharmacist, the specialist mental health pharmacist, was almost like the mediator between the two links to ensure continuing care of a patient between two different facilities and primary providers. And we found out that through an integrated process of, number one, initiating champions within nursing sectors, within psychiatry sectors, within the hospital system, we found the buy-in was essential, and that happened through allocating champions. And these champions not only made it their baby, but it was a driving factor, and the patient was the ultimate outcome. So for a nurse who led the project on site, she was trained in metabolic and medication reconciliation processes by the specialist pharmacist, and over time we found out that close to 80 clients attended over a month, and our metabolic results, our medication reviews rose up to almost 70%. 70% of a reach was reached, and with that we prevented multiple adverse drug reactions and managed multiple side effects from patients. And one example is, a patient was managed on a mood stabilizer, which was topiramate, which is also an anti-epileptic, and she was having worsening myopia, and it was documented everywhere that she's having worsening myopia. She's changed her glasses about 6 times in the last 2 years, but nothing was done to look into that further. But through the establishment of this service, the pharmacist was able to liaise with the GP, liaise with the psychiatrist, and nail down the cause of this, and we're able to facilitate and change and improve the quality of life for this particular patient.
And are you able to still do this? Is this all still going on, or was it subject only to funding?
Again, funding is a barrier to a lot of these great things. We had funding for 6 months, and at the moment we are looking for alternative ways on how I can fund this project. In saying that, we have tried to absorb some of the phone consults. So through this, we've had a lot of other remote sites calling us for phone consults. What do I do in this case? Clozapine's not working. They're showing signs of TD, tardive dyskinesia, which is movement. Extrapyramidal side effects. And what do we do? What are the other options? Or how can I get a history of all the medications they've tried on? Or what do you suggest? So these are some of the conversations that are happening. And again, we can get the point of care, we can get care for the patient right there, but also having that specialist role of knowing what a GP can do, knowing what an endocrinologist can do. So the pharmacist is able to facilitate that process, initiate medications where needed with the advice of GPs and so on. So it's really about integrating the role, and that's where the key is in improving mental health care delivery.
As a pharmacist, you'll have sat here for the last couple of days, and it would have come up in that project as well, as you've said, that polypharmacy, over-medication, the wrong medication, serious issues for for the physical health of people with mental health issues. What do you think pharmacists are doing wrong? What do they need to do differently?
Well, I think a pharmacist is definitely out there, first point of call, first point of care, and we heard over the lectures over the last 2 days that 20% of mental health patients are likely to discuss the issues with their medications with a pharmacist, and psychiatrists are like 6%, nurses are up there as a 12%. So we are really at the forefront of engaging with clients and making life better for them. But the key is for pharmacists to be trained or be familiar about mental health, and that's the stigma of the whole situation. Most pharmacists, community pharmacists, they're scared to touch patients that have mental health issues or are on medications for mental health conditions, and that really has to change through education and through specialist mental health pharmacists such as myself. There are only a few of us across New South Wales, but we'd love to get out there and train some of these guys and know what the treatment algorithms are, to know that how important it is to get a history of medications for a mental health client, so we know that we're not repeating, we're not reinventing the wheel, we're not making the patient go through the same process 3 or 4 times, because when they've failed a medication in the past because of a side effect, there's no point trying to go through that same process. It's about knowing what's out there. Let's try and get a medication that fits the patient and their best interest, and that's what I think pharmacists should be working on.
And is the barrier to that about training, and about stigma, and how much is it about actually not these gaps between specialists and the gaps between the health care? Is that where it falls through?
A part of it is the way that a pharmacist is trained. We have pharmacists in the community, in a shop. They do a great thing, and there are pharmacists in hospitals. And I think what happens over time is we fall into a little niches, and it's difficult for us to come out of a comfort zone. And I think mental health is one of those illnesses that requires you to come out of your comfort zone, being able to put the patient in the centre, because all that we're passionate about is the patient. And when the patient is the focus, then your willingness to engage, your willingness to learn, your willingness to adapt and take on a new role, or even look at how you can engage outside of the box is really essential. And I think that happens through patient as the centre in every care.
What led you into this specialty, if I can ask?
Well, mainly I'd like to say having the right mentors, having the right leaders, and people speak into my life, but also having a personal friend who went into bipolar disorder when I was much younger, and that sort of instilled and motivated me to see why has that person changed from how they were to now. What's causing that change? And I know this person is this, but whatever's led them to this, let's see how we can better improve the care. And seeing those patients, seeing my friend of mine growing in weight, and getting diagnosed with diabetes, polycystic ovaries, etc., sort of led me to believe that let's be part of this team that can improve the quality of life of these clients. End of the day, they are humans. We need to ensure that whatever care is given is optimal, number one. Number two, also is not inflicting further harm over their general course of their journey.
And Steve, so you can have some lunch in a minute. What's your takeaway from this event? Have you learned something new? Have you been surprised?
I guess this topic of physical health has really resonated in my heart from all the lectures here. They've all been top notch, and for a conference that was free to all of its members. But this, the way that the speakers are lined up, the caliber of all the people here, just makes it a class act, and it's been phenomenal. And one message that I'd like to take home is we can work together as a team by working and building on each other's strengths, and that's really happened really well in this conference.
Thank
you so much.